we are going to try and get started now. That way we stay on time and we end on time, which of course is what everybody wants. So if you guys want to take your seats, and this afternoon is all about outreach and enrollment. We will be going kind of more and more into detail as we go along, but we are starting out with outreach, okay? And so our guest in this first half hour is Michael Radtke. He is the organizing lead for Enroll America. I am going to let him talk to you about what that is, except you know it's about enrollment.
Do I have to use the microphone, or can you guys hear me okay? Is that all right? Wonderful. Again, my name is Michael Radtke. I'm the Michigan organizing lead for Enroll America. Alyssa Ramos is here. She's the organizer, for Washtenaw, Genesee, Ingham, Jackson. She's our mid-Michigan organizer. She does a great job for us here. Just really quickly, we're going to give you the Get Covered America strategy session for Washtenaw County on our work here in Washtenaw County, what our goals are, and what our outreach techniques are going to be. We're going to have you better understand the mission of the Get Covered America campaign, how we're going to implement our state plan, and how hopefully your organization, the people who volunteer with your organization, might be able to get involved with us and help basically identify the uninsured, and hopefully starting October 1st and then January 1st, getting them the health insurance they very badly need. So who are we and why are we here? The Get Covered America campaign is a special project of Enroll America. We are a national, nonprofit healthcare campaign. We do education and outreach around the Affordable Care Act. We started out in 2010 with 5 employees. They were a public policy shop, just didn't know what the Affordable Care Act should be and how it should go. And quickly we've expanded. We have something over 130 organizers now. We went from 5 to really big. It's been wonderful because we had a nationwide training, I believe, was it in the beginning of August? August. We had 100 then. Now we've already got almost 150. So we're just growing exponentially. We focus on basically 13 states, but often 10. And then the states will have the highest number of uninsured. And most of those states did not choose to set up their own health insurance exchange. They decided to have the federal government come in and do it. So they need the most outreach help because they turned down a ton of federal money that would help with navigators and other outreach efforts. What are we focused on? Outreach and education to consumers, specifically the uninsured, and maximizing health coverage enrollment. Our sole focus is to identify the uninsured, to know where they are and how to contact them, and starting October 1st, push them to navigator groups, push them to the healthcare.gov and healthcare exchanges, and follow up to make sure that they are enrolling in health insurance. What we don't do, Medicaid expansion. Now, this is an interesting caveat because now we kind of do Medicaid expansion. Thankfully, the governor signed the bill that will allow Medicaid expansion to go forward in the state, which I'm sure all of you know, if they hadn't signed that bill, there'd be an enrollment gap where folks who are too little money to enroll in the healthcare marketplace, but too much money to qualify for Medicaid as it was. So this is going to go forward. We are identifying those folks who are eligible for Medicaid, and we're going to be pushing them toward the Medicaid enrollment office. And the great thing about the new application, as I'm sure all of you are aware, is it's a unified application. So if you sign up on healthcare.gov for the healthcare marketplace, it will shunt your application wherever it should be. So if you qualify for Medicaid, it'll put your application to the Medicaid office. If you qualify or totally qualify for CHIP, Children's Health Insurance Program, it'll push your application to that. If you qualify for Medicare and for some reason you don't have it, it'll push it over there. And if you don't qualify for anything inside the marketplace, you'll be eligible to go on there and get a plan that works for you. We do not do voter registration. We have a database that tracks folks, but we don't do anything to do with politics. We're nonpartisan, nonprofit. We are past the politics of the Affordable Care Act. Some folks want to argue with us about this, like, why are you for it? We're not for it. It's here. It's not going away. We need to make sure that folks know about it and know how to use it. And we don't do in-person assistance or small business health care coverage. Now, in-person assistance is kind of funny because we're not navigators. We chose not to become a navigator group, but we partner with them. With APHIS, the American Indian Family Health Services, Access in Dearborn, Michigan Consumers for Healthcare, the navigator groups here that are working, we talk to them on almost a daily basis because we're very close friends, and we're going to be helping them do a lot of work come the fall. Where are the uninsured, right? Essentially, these 13 states, as I said, are where the uninsured live. 60% of the uninsured live in 13 states in this country. Michigan is I think number 11 on that list. The largest, California and New York, those are the two states that we're not in. Everyone says, why aren't you in California and New York? There's so many uninsured. California and New York chose to go forward with a state-based healthcare exchange. They received tons of millions of dollars from the federal government to implement those exchanges. In Michigan, we got $4 million because we refused the money, which is, it's a pound foolish, right? So essentially going forward, we're building a community-driven movement. This is all about the uninsured. Essentially, 45% of the folks who are uninsured in this country are white, 32% are Latino, African American are 15%, and 8% are other, which is Asian Americans, Indian Americans, Native Americans, and other people who just chose to be certified, chose how not to identify themselves. Income, about 51% of the uninsured in this country fall about 138th or less on the federal poverty line. 38% are 139 to 400. And 10% are 400 plus. We are really targeting the 139 to 400 group, my organization. The 138 and below, they're going to be qualified for the new Medicaid expansion. We are identifying them, we're going to push them to the Medicaid expanders, but we're not as focused on that group as we are on people who don't qualify for Medicaid and might not understand how to enroll in the new healthcare marketplace. And the age gap is really 19 to 35 is the group that we're really pushing for, because these are the folks who often are called the young invincibles, the folks who choose not to have health insurance. They know they should probably have it, but they're like, I'm healthy, I'm young, nothing's going to happen to me. And as we all know, oftentimes catastrophic events happen to these folks. No one chooses to get sick. No one chooses to get injured. Usually it's beyond your control. And this was taken in November 2012, so these numbers have changed a little bit, but we did polling, and 78% of the uninsured don't even know about the new healthcare exchanges, and 83% of people who would be eligible for the Medicaid expansion don't know it went through. Now, I just saw some new polling numbers on this. I believe they said it's gone down to 54% don't even know about the new healthcare exchanges, which is good. I mean, I'll take credit for a lot of that, but no, I mean, everybody out here is working very hard to inform folks about what's coming and how they can get enrolled. So I think we're doing an excellent job on that. The Medicaid expansion hasn't really budged yet because folks really don't know if they qualify and how they qualify. And we've also faced a lot of interest in folks who are like, if I qualify for Medicaid, can I go into the marketplace and get the tax credits and get the financial assistance? And the answer there is no. If you qualify for Medicaid, you do not qualify for tax assistance on the marketplace. But that's the kind of a caveat. Medicaid is free. The marketplace obviously is not. Consumers want to know their options. When you talk to consumers, we did a live person survey, over 1,000 people to talk to them. 69% when we told them what's coming, they're interested in hearing about their new options. 16% are obviously not interested for any number of reasons, and 12% are kind of like, let me hear about it, we'll figure it out. And we find that 4 key messages really reach the most number of consumers. 1, all insurance plans are going to be written in the same exact way on the healthcare exchange, comparing apples to apples with no confusing consumer jargon, and they have to be written in no more than high school English with no fine print. And folks ask, what does this mean? I'm a pretty educated guy, right? I'm pretty smart, but whenever they say in-network provider and out-network provider and all these terms that are very interchangeable inside the healthcare world, your average person who's working 9 to 5, they have no idea what that means. And luckily, going forward, the marketplace will hopefully simplify this process and allow people to really understand what they're buying. Additionally, if you have a pre-existing condition now, insurance plans can no longer deny you coverage. This is a great top line. My mother had a pre-existing condition. She had multiple sclerosis. Because she had multiple sclerosis, and then she got cancer, no one would cover her. She was uninsurable. When you're sick, you're a nurse, my mother was an RN. When you're sick and you're a nurse, you'll be able to get coverage in this country. Not for my mom, not when she got sick. So now going forward, people will no longer be denied coverage because they are sick. Furthermore, all insurance plans have to do what's called essential medical benefits. They have to all have the same thing. A lot of the ones that are top lines are emergency care, ambulatory services, prescription drugs, pediatrics, maternity care, and prescriptions. All the plans on the exchange have to cover these options. And the best top line I find is you're eligible on a sliding scale to qualify for financial assistance if your employer does not provide healthcare insurance to you. And then when I say a sliding scale, if as an individual you make less than $46,000 a year, $46,000 a year or less, you are eligible for financial assistance. The less you make, the more assistance you get, obviously. If you're in a family of 4 and you make $96,000 a year or less, you're eligible for financial assistance on a sliding scale. And how does financial assistance work? It's going to be a form of tax credits, but they're going to be instantaneous. So you go on the marketplace, you sign up for a plan, you apply, and then immediately they take off whatever your assistance would be off your bill. So if your bill is $100 and you have a $75 tax credit, your payment every month would be $25. How will we? Sorry, go ahead.
Are those true for all insurances, not just the exchange, but all private insurance as well?
I don't know for private insurance. I know on the healthcare exchange is the way it's going to be. Thank you. I'll probably get back with you on that because I'm actually curious myself now. How will we do this, right? How will we find these folks? How will we identify them? How will we push them to the marketplace and hopefully get them enrolled in healthcare coverage? I'm sure some of these folks have seen this before. This is the Grassroots Structure. Basically, we call it the snowflake model. With a very small, not a very small staff, but a small but mighty staff, as we say here in Michigan, on the bottom. A team model structure on top of that, a team member structure on top of that, and a volunteer structure on top of that. I have 7 organizers across the state. Most of them are on the east side. We have 3 in Detroit, 1 in Macomb County, 1 in Oakland County, 1 in mid-Michigan, 1 in West Michigan. And then I try to cover, supposedly I have UP, but I've not been up there yet. I heard it's very lovely this time of year, though. So, yeah. But essentially, we try to work by encouraging volunteers and putting them into a structure that they can benefit us. The snowflake model here, if anyone from a political campaign or anything else has seen it before, this is the team in the center. This will be the team leaders right here. These will be your top volunteers. And on the structure around everyone who wants to get involved to help us out. And our campaign structure is going to be, we're going to combine several different things. Data analytics, I'll tell you about my database in a second. The database we have is excellent. Every day it's getting better because we're doing more outreach and more contacts. Field outreach, which is my sole job, getting out into the community, doing presentations like this, having canvases, knocking on doors, calling folks, get them involved. Messaging, which we're going to do some direct mail and some hopefully some commercials, but those are expensive, so we'll see just how much we have at the end of the day. And digital outreach. We are going to have hopefully a follow-through webpage where if you go to getcoveredamerica.org, it'll splash you right onto healthcare.gov to get you enrolled. Or the digital team's working on that right now. Our campaign timeline. First, we're doing capacity building education. That was until September, but as with all things, we kind of do it all the time. October 1st, the marketplace opens. That's going to be phase 1 enrollment. We're trying to push as many people out in October as possible until January 1st. January 14 to March 14 is phase 2 enrollment, and coverage will begin. And we think when folks start getting enrolled and then start seeing the benefits of the healthcare coverage, I think that this phase 2 enrollment is going to be a big thing. Folks are going to have talking to their neighbors. I have health insurance now. My coverage is good. I pay a reasonable amount for it. I hear horror stories every day, folks, of folks who pay over $1,000 a month for healthcare coverage. Hopefully that'll go down. And I think at that point we have a second rush of folks who are like, I need to get on this before it's over. Then April through September of next year, we're going to do some listening and some capacity building and basically some retooling. Because I'll be honest, folks, the campaign we're trying to do here has never been done before. Never as a public policy issue been done almost like a political campaign or an outreach campaign of this nature. So every day we're learning stuff that's fascinating to us. One thing we've learned is, in the political world, canvases go off on the weekends usually because most people are home. And we find with the population we're targeting, a canvass on a Wednesday at noon oftentimes is just as effective as a canvass Saturday at noon, or even more effective, because the folks we're targeting work different hours, they work odd hours, they're not home when you think that most people who would otherwise be home. So we found some success with that. And then, October 14, the marketplace will open again, and hopefully we'll be able to enroll as many people as possible in a shorter enrollment period next fall. So building our list. We have a database. It's an interesting database. It has information from all kinds of different things. Voter registration rolls, consumer data, partner data, and basically we are able to, I don't know if the slides, no, it's not here, okay. Used to be a slide on it, on how we built a list, but essentially we combine all this data and we give people a numerical score of how likely they are to have health insurance or not. And then we cut the list in half. We took the 60% who are most likely not to have health insurance, and And we divide that into 3 tranches, essentially. And we're targeting the people who are most likely not to have health insurance. Now, is this perfect? No, we do encounter folks every day, and people's circumstances change. So maybe you have health insurance today, but you get laid off and you don't have health insurance next month. But we found our database is very effective, and we love to partner with groups. We are willing to give people who are not health insurance companies access to our database to identify the uninsured, to help with their outreach efforts, and to basically collect data for us so we can help target them. What are we doing with this data? We collect, and you all have commitment cards there, and I'll talk to you about those in a minute. What are we doing with this data? We are basically drawing it in, putting it in our database, and using it to improve, to means test, and to basically push those folks out to enroll in healthcare coverage. What we're not doing with it, if we're not selling it, we're not giving it to health insurance companies so they can use it for their own purposes. We're not doing anything with it that's not for our nonprofit public purpose, which is basically just identify the uninsured and get them out. We don't sell it, we don't partner with anyone to give it away in that type of manner. If you're interested in getting involved and using a database, please talk to me after. I'm not an expert in this, but there's usually a partnership agreement that has to be signed. We don't ask for any money, but there's some rules and some data training that might have to go into it. But I'm more than willing to talk to you after the meeting about that if you're interested in that. And our field tactics, these are pretty standard for most campaigns. We are holding one-on-one meetings. I know Elisa had one at 10 a.m. today, right, Elisa? Was it good? Yep. Talking to folks and engaging them in the community. We hold house meetings and house parties. And we also have been doing a series of ACA town halls, different representatives and commissioners all throughout the state. And it's been a wonderful, I was at one in Sterling Heights on Monday, and we had a turnout of 200 people. Now, sadly, 100 of them are on Medicare. And the folks were like, the one thing that's going to happen is Part D is going to shrink. It's going to shrink until it's almost not there anymore, which is going to be great for people on Medicare. But for everyone else, we're trying to identify them. We run phone banks, we run door-to-door canvases. We have canvases going almost every week, and they're all every week now. We have phone banks going every week, and they're in different places. And if you have volunteers, and a lot of you are part of organizations that might have volunteers or have folks who want to get involved, we're more than willing to give you the resources you need to have a phone bank, to have a canvas, to partner with you to run a canvas, get out in the community, and identify the uninsured. Do you have a question?
Can you explain about what you meant about Medicare D going away?
Sure. Medicare Part D is a prescription drug benefit. Right. Under Obamacare, or the Affordable Care Act, however, it depends on the audience I'm with. I remember I went and did a bunch of interviews to the press. I was talking about the Affordable Care Act, Patient Protection, the Affordable Care Act. And then I was out in the community in Detroit, and people were like, what's that? I'm like, Obamacare. Oh yeah, I know about that. So essentially, under the Affordable Care Act, every year, Medicare Part D will shrink a little bit until it's down to, I believe, it's 12%. And by 2020, it's supposed to go away completely. So the donut hole that people are falling into, like my grandmother who was diabetic, that they were falling into, is going to slowly disappear every year until it's gone. Which will be great for folks who can't afford their prescription drugs right now.
Excuse me.
Yes, ma'am.
What about Medicare supplementals for people that have a hard time paying for those?
Yeah, and that's been a big. I don't want to get off too far off track, but I'll address this too. That's been a big, not a complaint, but folks are worried about it. I know that Medigap coverage is changing in Michigan. I'm not an expert in that type of coverage, so I apologize. I'll just tell you what I know about it. I know that Medigap coverage is becoming more expensive next year because under the Affordable Care Act, a lot of the Advantage plans for Medicare, they were being highly subsidized to the tune of 50–60% by the healthcare companies. And they're actually not really affordable, they're not really good plans. And essentially, under the Affordable Care Act, if Medicare Advantage wants money, they have to prove that they're doing something better than traditional Medicare. And so a lot of the providers who are doing it right now, the insurance companies are saying, Obamacare cut your coverage. No. As you know, under the Affordable Care Act, health insurance companies have to spend X much money, they bring in premium dollars, on care. For individual plans, I believe it's 82%. For group plans, 80%. If they don't spend 80% of the dollars they take in on coverage, they have to send you a rebate. And this is going forward now. Folks are starting to get these rebates. One of the problems with Medicare Advantage is they don't spend 80% on care. They spend it on just whatever profit sharing they want. So now they're saying, well, this is what's going on. But we can talk more about that after.
But my question was, thank you for that, but my question was really, is there any part of this program going to subsidize people getting a supplemental?
No, sadly, no. And one thing that's good about the Affordable Care Act, though, in reference to Medicare, is the Medicare trustees said that because this has slowed so far healthcare spending, especially this year, that going forward, the Medicare trust fund is good for another 12 years. Just from this year's, the way that the insurance prices have dropped. So they say every year is supposed to be some cost savings, and that'll extend the life of Medicare before it. And I love the idea of Medicare bankruptcy. Medicare is not going to go bankrupt, folks. But eventually, if we don't bring in enough, it'll have to start cutting benefits a little bit. I believe I read that was 82% of benefits will still be paid in 2075. So folks, people get worried, it's going to go bankrupt, there's going to be no money for me. No, but this is going to definitely change the way it works.
Yeah, I just want to say, you have in your slide set, Mary Ann has a slide that is specific to the changes in Medicare, and I would just refer you back to that slide.
Pardon me, I'm getting a little dry here. And then we're also staffing tables at community events. We really are hoping to get into community centers, businesses. We do barbershops a lot where people are congregating. And we've also had a lot of success with house parties and faith-based tabling. We'll go talk to the priest or the reverend. We'll tell them, we'd love to just have a minute to address your congregation. And we're going to collect cards at the end about information, and getting it back to folks. We found that this has been very successful. They want to partner with us because, again, we're not doing anything with the politics of the Affordable Care Act. We just want to find those who don't have insurance and get them to where they can get it. That's our sole goal. And our partner engagement. We work with a ton of partners to help spread our message. They kind of span the gamut of the healthcare sector, from like AARP to CVS Caremark. We're allowing us to table in their CVSs in Detroit right now, which has been a great partnership for us. To the Young Invincibles at SEIU. And we also, it's not on here, but several of the national business associations are partnering with us too. So everyone's like, you're a left-wing or a right-wing organization. We're not. We partner with everyone across the gamut. Our sole goal is to partner with people who want to help folks get enrolled in healthcare coverage. Our digital outreach, getcoveredamerica.org. It's a great website. It's going to have how you can help, how you can enroll, a quick process to walk you through how you can enroll. We also post all our community events on here. And other folks will have to post community events on here too if they're going to do outreach on the Affordable Care Act. We urge everyone to use our website. It's free. There's no charge. You don't got to register. And we post all our events. I know Lisa probably has some canvases in Washtenaw County up on there right now. Right, Lisa? That's great. And we'll talk about those in 1 minute. And Get Covered America in Michigan. The top 5 counties for the uninsured in Michigan are Wayne, Oakland, Macomb, and then take a step further back, Kent and Genesee County. So we really are targeting our main work, definitely in Wayne, Oakland, and Macomb, and also Flint. Flint's a very important area for us. But there's communities right here in your community that really need healthcare help. One of them is Ypsilanti. I have a ton of, we call them priority precincts. Precincts that have a high number of uninsured in them. We have a ton in Ypsilanti. We've been targeting them the last few weeks. With your help, hopefully we'll target a few more and get some more people on the doors and on the phones and to work for those. But there are a ton of folks here in Washtenaw community that can use your help too. And upcoming key dates. This is Lisa's slide. She put in last night. Saturday, 9/28 and 10/5 at 10 a.m. We are going to canvass in Ypsilanti. We'd love to get your information and get you on board, or get folks you know in your community, or even volunteers at your organization on board. We go around and we knock doors, and we talk to folks, and we're basically going to just be identifying. We have a good idea of who they might be. We're still going to make that initial conversation on the door, give them a piece of lit, and make them understand why they need to enroll. Wednesday, 9/25 and 10/2, we're going to have phone banks at Espresso Royale Cafe on Main Street. Great location. I used to study there when I was an undergrad at University of Michigan. It's very busy. Love it. We're going to be making phone calls to the uninsured. We've been having some success with this, to talking to people. One thing we are facing is, in any population that is somewhat transient and moves around a lot, we have a lot of bad phone numbers. So the best way to get those bad phone numbers out, to contact the folks we need to contact, is to make a ton of phone calls to clean the database, essentially. Please contact Alyssa Ramos, right here, at 517-203-8926 for more information. Or go onto our website, and you also have literature. And I wanted to talk to you briefly. I think that's it. Yep. So, let me talk to him briefly about the 2 pieces of literature I passed out. Okay. Everybody has this. This is what we call our quad foil. It's pretty kind of cool. It has all kinds of information about why you should enroll in the Affordable Care Act and why it matters to you. I always like the out-of-pocket insurance expenses report at the bottom here. On average, to fix a broken arm in this country, if you don't have insurance, it'll cost you $7,500 out of pocket. If you were in the hospital for a 3-day hospital stay, it'll cost you $30,000. I know this personally. I was on Medicaid at one point in my life. I was sick, I was young, I got put into the hospital, didn't know what was wrong with me. I stayed there for 3 days. And then I got a bill. And that bill was scary. Luckily, I had a really great health social worker at the hospital who guided me through the process of signing up for emergency Medicaid and got those health care expenses put away. But again, I'm a pretty educated man who spent a heck of a lot of time at the Medicaid office getting my expenses paid for. For someone like my brother who's the manager of a Jimmy John's and you work 50 hours a week, and you're working every day, we try to tell them about this type of stuff. They go, that's great, I don't have time. I have to work. So what we're trying to do is make it easier for folks. We want to get those people's name and information. We want to get them to the navigator groups, and we want to touch base with them to help make this process for them as easy as possible. The other thing we have, and by the way, you guys can all have as much of this lit as you have. I have a gigantic box with me today. I'm willing to give anyone 100 pieces or 200 pieces for their organization. We're having more that come in every day. If you give me your business card, Elisa will definitely drop off some more lit with you. The other thing we have here, and please see me outside afterward, we'll talk about that. We also have a commitment card. And if it's a commitment card, what is this? This is basically a follow-up card. It bends, you can cut in half. People fill it out. I'd love for you all to fill it out today so I can follow up with all of you. But essentially, you fill this out, and you there's a couple check boxes on the bottom here that says, send me alerts, I have health insurance, I'd love to volunteer, I'm looking for better coverage. Feel free to write stuff in here like, I work for a health insurance company, I'm giving you my information. We used to do sign-up sheets. We found that people skip sign-up sheets a lot. When you give them cards, they kind of have a rip-off receipt. For some reason, they love it. And this really works very effectively for us. And we'd love, if organizations are willing to partner with us, to put drop boxes in your locations with these cards. All this does is you fill it out. There's a drop box. Go get the drop box, please. There's a drop box outside that we created. We're doing a bunch of these. They're kind of very simplistic. But collect the cards. Elisa will come by on a weekly or bi-weekly basis and pick them up. And then we touch base with everyone who fills out this card. We put this information on there, we put it in the database, but we also, especially for those people who are uninsured or want more information, we're going to touch base with them to put them in touch with navigators and with other groups. Here's her box that she has. It's a really simple box. We provide them, put them on your countertop, put the cards inside. We will come and get them. Then folks do go, what do you do with this information after you collect it? Well, we put it in a database, and then we shred these cards. These cards do not get sold. They do not get put in the trash can or they get thrown away. We keep this information very private because obviously folks are giving us information to help them, and we don't want to abuse that. So I guess that's our presentation. I just briefly, is it time for questions, or am I out of time?
Yeah, no, you have a couple of minutes.
Does anyone have any questions about this?
A couple of questions.
So you don't do Medicaid? I mean, I couldn't tell by what you said. Well,
what we do is, Medicaid is doing their own push. They have a lot of money to do their own push right now. We are targeting folks. Anyone who doesn't have health insurance, including folks who are on Medicaid or who even Medicare disability. We are more than willing to get their information. We are more than willing to take it in. But we do Medicaid. I think they just make it very clear. We do Medicaid. But our sole focus, where we feel the gap is and what people are doing, is with young invincibles aged 18 to 35, mostly young men who need coverage, don't have coverage. And we found the most effective way to reach out to them is oftentimes through those who are closest to them, their mothers, their girlfriends, their grandmothers. I can't tell you how many times I knock on a door or I go to a church event and someone's like, I have Medicare, but my 3 grandchildren don't. Well, that's people we want to reach. And this new unified application is going to help that because say you have a mixed family, you have 2 children, a pregnant wife, and a husband who has no insurance. You put all your information into the marketplace application and it'll decide, maybe your 2 children qualify for CHIP. The 2 children will go on CHIP. Your wife, because she's pregnant, qualifies for maternal Medicaid. She'll go on Medicaid. And as the provider, as an adult, as a male, you don't qualify for anything, sadly.
Okay, so my question is, I see a lot of people who make about $1,000 a month. They're eligible for Medicaid, but they have a spend down of $400 a month. It's not useful to them.
We're going to talk about them
Okay.
in about an hour.
Okay.
Great.
Okay, and just to clarify, Enroll America does not do any enrollment. So I know, maybe you should think of them as Outreach America.
Well, that's why we do Get Covered America, our campaign. Because we actually don't enroll anyone. We just basically collect all the data and try to work with our partners to make sure they are getting enrolled. But we don't, none of us will actually walk someone through the marketplace. Any other questions? No? Thank you so much, folks. I appreciate it.